Today's guest speaker is our club member, Shawn Daly from Moscato Associates in Ithaca. He's going to talk about the ins and outs and the probably the myths and virtues of Medicare. Some of us are at it. Some of us are around the corner. Some of us are a long way from it. So without further ado, please join me in welcoming Shawn Daly.
Thanks, Ed. That was easy. Good chance, why don't you just share that?
Sure.
Well, as Ed said, I work for Moscato Associates. It's a broker down in the Ithaca area. Prior to that, I was a police officer for 20 years in the city of Auburn. And a lot of people always ask me, how do you go from law enforcement to Medicare, and would you like to do better? And the Medicare is much easier. I don't have to chase people. I don't have to fight with people, and I haven't got punched in the face yet. So I prefer doing the insurance for Medicare. It's much easier.
Nice.
So there are some misconceptions about Medicare. When I speak about Medicare, everybody just assumes it's for the crowd that's 65 and above. Okay. So that's the one way you can qualify for Medicare is if you're 65 or above, but also if you are fully disabled, you can qualify for Medicare. I have individuals that I help with Medicare that are actually my age or some are younger. And the way that occurs is if you are on Social Security disability for 24 consecutive months, on the 25th month, you actually qualify for the Medicare. Okay. There's also certain diseases that allow you to qualify for Medicare prior to age 65. Lou Gehrig's disease is one of them. And if you guys open up your sheets or the handouts they gave you, Medicare is a federal program that started back in 1965. Sometimes when people are talking about Medicare, if they're just turning 65 and aging in, a lot of times they don't know Medicare, Medicaid, what's the difference? So the way I remember is Medicare, we care for the elderly, and Medicaid, the aid, we aid people that are less fortunate or have lower income than us. So that's kind of the distinction that I make between Medicare and Medicaid. So it's a federal program, whereas on the Medicaid piece, that's run at a state level, okay? So Medicare has different types. There's Part A of Medicare. Anybody in the crowd know what Part A stands for, or what it actually covers without looking at the sheet? Hospitalization. Okay, right. So Part A is hospitalization, and you can see there under those bullet points, there's some different things that are covered with the hospitalization. There's an inpatient care, skilled nursing facility, hospice, home health care. Now, Part A is free if you've worked 40 quarters or more in your adult life, either you or a spouse, okay? If you go back years, prior to my time, you might find people that are in a household that, the husband went to work and mom stayed home and raised the family. So she would actually qualify based on her husband's work record as well. Now, pretty much every household is dual income, so it really doesn't apply, but 40 quarters of work qualifies. Your Part A, there's no cost to as far as a monthly premium. Now, your Part B, that covers your doctors and your medical. And again, you can look there under Part B, the different things that it covers. With Part B, there's a monthly premium. Does anybody know what the monthly premium is? Ballpark?
183.
Sharon?
148.
148.50, correct. 148.50. They take that right out of your Social Security benefits. So if you look at your Social Security benefits, you'll see the amount that you make, and there's a line under it for 148.50. You're actually paying for your Part B. Does anybody know what happens if you're still working and you're on Part B, but you're not having to take it out of your Social Security? Well, Tim's question then, if you are still working, but you're on Part B, they're going to bill you for that quarterly. Okay. A lot of times it's easier if they just take it out of your Social Security because you don't miss it. But if you're not drawing your Social Security for whatever reason, and you're holding off till later on in life, they can actually bill you quarterly for that. All right. Now, Part A and Part B, that's what we refer to as original Medicare. Okay. With original Medicare, there's a $1,400 deductible for your Part A and there's a $200 deductible for your Part B. Once those two deductibles are met, then the cost sharing kicks in, the 80% the federal government is paying, and then you pay the 20%. So when you're on original Medicare, the federal government is actually managing your care. Okay, and that's important because later on, when you look at the different options you have, that could change. All right. Once you have your Part A and Part B, whether you turn 65 or you've been disabled for 25 months consecutively, then you'll have the red, white, and blue card everybody recognizes. It'll say Part A effective date, Part B effective date. Does anybody know what is needed beyond your Part A and Part B? Drugs. Part D. Okay. So with the drug coverage, it's easy to remember. All drugs is Part D. All right. Now, when you are first eligible for Medicare, you have 63 days to qualify to actually sign up for a Part D plan. All right. I'm a numbers guy, so I'm looking at that 63 days. Why isn't it 30? Why isn't it 60? Why isn't it 90 days? So I'm trying to wrap my head around it. Well, if you look at, there's 2 months in the year that are consecutive, that are 31 days. So if your effective date was, I believe it would be August 1st, I think it's either June and July or July and August. But if your effective date was the first of that month, you would still be compliant. If you do not have drug coverage within that 63 days, anybody know what happens?
You go to drug jail.
You go to drug jail. There's a penalty, and the penalty is based on 1% of the average drug use of a senior citizen. Okay. Very plainly, it's about 32 to 35 cents per month. The only problem with that is that penalty never goes away. So whether you live to be 66 years old and you drew social, or you were on Medicare for 1 year, or you were 165 was 100 years, you're paying that fee every single month.
Wait a minute.
Yes.
So I just need clarification. So am I hearing you say that I have 63 days to do it? If I don't do it until 64 days, I now have a penalty for the rest of my life?
Correct. Correct. It's the federal government, unfortunately. Yes, Michelle.
I mean,
Drug jail
how can
for
they
what?
make you sign up for something? I mean,
They can't make you sign up for it. And what we find, maybe in Mac's case, if he uses the VA, I run into a lot of veterans that have never signed up for their Part B because they go to the VA doctors. Okay, they don't want to spend that $148 a month.
They most likely have TRICARE.
Correct.
Yeah. So that's not the VA.
So if they had TRICARE, then they wouldn't need Part B.
And there's TRICARE and TRICARE for life. TRICARE is my part. That's
Okay.
as well as
So-
other things.
Right. So that drug penalty never goes away. I was dealing with a woman down in Ithaca Walmart like 3 years ago. Her and her husband were farmers, and they had original Medicare, and they signed up for it 25, 30 years ago. They never knew they needed drug coverage, and she actually had like a $30 penalty per month, which is unfortunate. They do put a cap on that. About $25 to $30 is the highest it goes because they take there's a 10-year cap on it, but there's a penalty. So there are ways around that. If you sign up for, if you're taking no drugs as a senior, you're turning 65, you're not taking any drugs, like Michelle says, well, how can they make you sign up for it? They can't. But there are products out there, there are zero premium plans that include drugs. Okay. So I'll talk about that in a little bit. So if you're a drug plan, you would actually pay a monthly premium. Some are as low as $7.30, and some go up to $100 just for your premium. Obviously, you pay your monthly drug premium, but then you have the cost of your drugs when you go to the pharmacy. So if I was taking drugs that were as long as my arm, I was taking 10, 12 drugs, it might be more appropriate for me to buy a plan that's $100 per month because those drug costs will be lower because I'm paying the high premium. If I'm not taking any drugs, or might be on 1 or 2 just tier 1 drugs, generics, which are zero copay, then a $7 a month plan might work for me. Okay. So once you have your original Medicare and your Part D drug plan, that's all you need to do as far as the government's concerned for your health care for Medicare. All right. Who here has heard of supplements? Okay. Not like CoQ10 or vitamin E, but supplements. What supplements are, I talked about that 80-20 cost sharing, plus that $1,400 deductible for your Part A. What some people do is there's supplements out there by different carriers. Excellus has them, Humana, United Healthcare. with these supplements, you pay a monthly premium. Okay, so you're paying your $148.50 for your Part B, plus you're paying a monthly premium. What those plans do, and they're designated by plans, they start out Plan A and go all the way to Plan N. Some of the letters do not have a corresponding part though, because they've been phased out. Like one very popular plan was a United Healthcare Plan F. You can no longer enroll in Plan F if you're just turning 65. It's kind of been phased out, but if you already have it, your grandfather did or grandmother did. So with those supplements, what they do is a lot of those take that $1,400 deductible, and that's no longer applies. So if you're going to go to the hospital, and I get admitted to the hospital, I have a $1,400 bill, or I could buy a supplement, pay on the low end $200 a month. But I know if I do get hospitalized, that $1,400 bill is going to be there. But also that 20% cost sharing, that's your responsibility. When you get a supplement, your co-pays and co-insurances for almost all the supplements, the more expensive ones, they're paid for. Okay, so supplements are a good thing. For people that are elder, I mean, I see people are 65. I don't consider them old. Okay, they're young to me because of the people I work with all the time. But if you're 80, 85, or you have a chronic illness, supplements are a good thing because you're paying that monthly fee and that's all. All right. The next thing go
Can
ahead.
you lock in those prices? Let's say I'm 65. I was going to ask you, does your prices for the drugs in Part D get locked down too? Say, for instance, you go in, you don't have any medications that you're taking at 65. Say 10 years later, you're on some medications.
Right.
Does the government modify that each year?
That's a great question, Tim, but nothing is everything in the insurance world, even as far as Medicare, there's always increase. Now, last year due to COVID, that's one of the few years that on the regular health side, like the Excellus plan, stayed about the same because there wasn't a lot of claims because people were going and using urgent care or the ERs because of COVID. Nobody was going to the hospital unless it's something really serious. So the Excellus plans on the group side stayed about the same. Generally, every year there's a little bit of an increase. That $148.50 for your Part B, every year that might jump up a little bit. So the premiums on the supplements, they increase as well.
Yeah, but it sounds like they're incremental as opposed to, an annual increase, as opposed to all of a sudden I'm going from no drugs, let's say I acquired cancer and I'm on all these cancer drugs now.
Mhm.
Does my premium go up because now
No,
So it does kind of lock in.
they're locked in for the 12 months are locked in. And generally the prices come out in like July. Like we're just getting increases now for our supplements. It doesn't go January to December. It goes like July until June. So if you were on a plan G for Excellus and everything was good and you were healthy and all of a sudden you got cancer, that monthly premium is still the same. They can't change it. But every year, generally, the premiums go up. Yes, sir.
What about the zero premium?
We're gonna get to those. Good question. We'll get to those.
But in the Part D,
Mhm.
they're charging you, I forget how much it's going to vary, right?
Drug plans start as low as $7 and they go up to as high as $100 per month.
All right, let's say I start at the very lowest,
Mhm.
and 5 years later, I'm on a whole bunch of drugs. Am I still paying just the $7?
More likely that premium would go up a little bit, but you can change, and I'll get into election periods as well. You can change your plans from year to year as well.
Why would you change it if it's covering all of your things for a lower premium?
Do you shop your PNC insurance every couple of years? Okay. What we do at Moscato is any of our clients, we send them out questionnaires in the fall. And what we're asking is, does your primary care physician change? Does your specialist change? But more importantly, has your drugs changed? Because drugs have, in the Medicare world, there's 5 tiers, 1 being the lowest, 5 being the highest. And your drugs can change actually from day to day. They usually don't, but they can change from day to day. So we shop your drugs for you from year to year because carrier A might be the best carrier when you initially turn 65. But if 2, 3, 5 years goes by, carrier B might be better for your drugs now because something changed on the formulary. Okay. So you could have a tier 2 drug on company A, company B, it might be a tier 4 drug, which is way more money.
Right, and because of the group, because of the federal government size, they can actually reduce the cost for those drugs, right?
No, that's set by the drug companies as well as CMS, as well as the carrier. So it's not just the federal government can't just come in and say, we're gonna lower the drug costs. There's too many moving parts there to do that,
Right.
but that can change. Yes, Michelle?
So on the Part D,
Mhm.
you pay the premium,
Correct.
but your drugs are no cost?
No, you pay the premium and then you gotta go to the pharmacy where you get it filled and there's gonna be a cost. Now, if it's a zero premium, if it's a tier 1 generic drug, it could have a zero copay.
Okay.
A tier 2 drug might be from $2 to $5. It's based on company, it's based on tiers. They're all different. So you're paying your monthly premium to have the drugs, to have the drug coverage, and then whatever drugs you're buying at the store, you're gonna actually pay out of pocket for those. That'd be your copay. All right, so now getting over to, I'm sorry, what's your name, sir?
Gary.
Gary's question. What about these zero premium plans? Who here has heard of a Part C Medicare Advantage plan? Everybody should have heard of them, even Mitch in the back of the
Hear it
room.
every 10 times a day.
10 times a day. If you watch TV,
During the
you've
day.
seen,
You get free food.
you've seen Joe Namath, you've seen all these things on TV, and those drive individuals like
Yeah.
myself crazy because those plans do exist, but you have to be on Medicaid, full Medicaid, and you have to be on Medicare as well. They're just looking for individuals in this room to call there, and once you get you on the phone, they're gonna try to sell you something, okay? So what the zero premium plans are, the Medicare Advantage plans, they take Part A, your Part B, which is your original Medicare, and your Part D for drugs. They combine them into one plan, okay? Now, depending on the carrier, they can add they can add hearing, dental, vision, gym memberships, meals,
Silver sneakers.
silver sneakers, exactly. So you get all these different benefits, and it's all wrapped in one. Now, your drug coverage, like Michelle said, I don't want to sign up for drugs, so I'm not taking any. If you sign up for a zero premium Medicare Advantage plan, your drug piece is now satisfied, and it's a zero premium plan. So generally, when I tell people this, I'm sitting across the kitchen table, they kind of look at me like, how is it a zero premium plan? Okay. Remember, with your original Medicare, who managed your care? Federal government. So once Shawn signs up, Greg's my agent, I turn 65, he signs me up on an Aetna plan. The federal government is no longer managing my care. Now Aetna is managing my care.
They get the 148.
No, you still pay the 148. There's no way around that unless you qualify if you have low income.
But
Okay,
you might pay every month or annually, if you
Correct.
wish.
and believe it or not, if people make a lot more money than the average person, that 148 can be higher. Most people I sign up, it's at 148.50. Okay. Excuse me. So the federal government manages your care. Now that Aetna is managing my care because Greg signed me up on an Aetna plan, the federal government subsidizes Aetna. So if Shawn's 65, he's healthy, and I don't go have a lot of medical problems, Aetna is in love with me, or whatever the carrier is, because the federal government's giving money. But for every 10 individuals like me or 20 individuals, you're gonna have somebody who has a massive heart attack, a stroke, gets in a car accident, gets cancer. So any insurance, it's just a law of large numbers. So those Medicare Advantage plans are very good. And people are like, well, what's the downside? Well, there are co-pays and co-insurances, okay? Now, there's in-network pricing, out-of-network pricing. Let me check the time before I don't go way over. Okay, so with the Medicare Advantage plans, you have PPOs and you have HMOs, okay? If you guys don't know the difference, you always want to, PPOs are much better. It's a more robust network. But preferred provider organization, that's a PPO. HMOs are health maintenance organizations. They're generally smaller and they're very regional. And I got two different examples. I go to see Mike, who's my doctor, to get some procedure done. And Mike accepts my HMO. His office accepts it. Well, Matt comes in to do the anesthesiology work on me. He knocks me out. Mike takes my HMO. The hospital does it. I assume that everything's good. Well, I get a bill about a month later. I open it up and everybody's sitting down because Mac's bill, I'm responsible for the entire amount because he doesn't accept my HMO. Now, the PPO, you have in-network and outer-network. Outer-network's a little bit more expensive, but it's still affordable, okay? People say that never happens, that would never happen. It does happen.
Oh, yeah, it does.
I had one woman down in Bath, New York, to sign up for a Medicare plan. She had an HMO. She needed a procedure done, so her kids lived in Ithaca. She went to Ithaca to get the procedure because she wanted to recover closer to her kids. Makes sense to me. Only problem is the HMO said, you got to pay the whole shot. So HMOs are very restrictive. If you grew up in Auburn, lived in Auburn, you never left Auburn, all your doctors in Auburn, HMO is fine. Okay. PPOs are much better. And that's where you get the in-network and out-network pricing. Okay. So to go see your family doctor might be a $5 copay. To see a specialist, it might be a $35 copay. ER visits like $90. X-rays $50. Surgeries start at $300 on the low end for certain carriers and go up to about $450. MRIs, CAT scans, they're generally about $175. So on the copays and co-insurance you spend on the Medicare Advantage plan, you'd have to have a real bad year to equal what you would pay in a supplement. So if you had a supplement, and just say for easy numbers, I spend $300 a month between my supplement and my drug coverage, so $3,600 a year. If you had a Medicare Advantage plan, that's a lot of co-payments and co-insurance to equal that $3,600. Now there is something on the Medicare Advantage plan. It's called the maximum out of pocket. Okay. Right now they're generally $7,550, $7,550, unless you're on a premium paying plan, it could be lower. Well, those maximum out of pockets, people get those confused with the deductible. There's no deductible with Medicare. You're covered from day one. However, if I had a Medicare Advantage plan and I had a massive heart attack, it was $150,000 in bills, I'd be on the hook for $7,550, which is still a lot of money, but it's way better than $150,000. Mitch.
So this question might be better if I wait until the end of your presentation, but I'm just trying to wrap my head around this whole process. So
Well,
You got
time.
to wait, don't you?
I will be selling insurance when you qualify. I'll probably be dead.
Well, never mind.
Go ahead.
So there seems to obviously this very complicated system, lots of moving parts.
There is.
My question is a chicken or the egg scenario. Does the medical community set prices for services and then like these federal services react to those prices so that they're not hemorrhaging money to provide for them? Or does the federal government assume that the rates that they're giving people are competitive and the medical community decides, well, we can make a little bit on this and then up their prices? So is it community driven or government driven?
That question is above my pay grade. If I had to guess, medical expenses are regional. Like you go to Rochester, the price of things in Rochester is more expensive than here in the Finger Lakes. Okay. Hospitals are supposed to be not-for-profit organizations, but they are businesses. They have to make money, to pay the bills, pay wages to employees, things of that nature. The federal government can set different regulations. Like I said, that's something way above my pay grade. There's too many moving parts there. I'm just a guy that shows up at your door and says, yeah, I'm ready to sign up for a plan, show me the plans, and then I enroll you. You know, I wish I had a better answer for it, but there's a lot of moving parts there.
I figured there was. I mean, a lot of people in my generation, you know, big call on free healthcare,
Right.
but is the
Nothing's free.
reason for free healthcare because the medical community is just trying to make a lot of money? Are they responding to government rates, or is it on the government to regulate those costs that are being developed in the medical community?
Not to get
balance it out.
too far off tangent, but in this country, there is, when everybody says that, you know, we'll never have socialized medicine. There is socialized medicine in this country to an extent. It's based on your income. If you don't have money, you can get all the care that's provided, you know what I'm saying? And then if you're a business owner that's trying to buy a family plan through Excel, you might be paying $2,500 a month in your premium, and your actual deductible would be like $30,000. So you're looking at $40,000 before your insurance kicks in. I have people ask me all the time, why am I paying so much before my insurance kicks in? And then on the other end of the spectrum, there are people that are low income and they get everything for free. So it's really not free, because those people are paying those high premiums and those high deductibles. They're funding everybody. You know, plain and simple, it's black and white. That's what it is. It's that simple.
Taxpayer funded.
Correct. Correct. Yes.
My primary care physician is part of a group practice,
Mhm.
and Mitch is, he deals with, or his practice deals with dozens of different insurers. And each one negotiates a different price for the same procedure. And it's absolutely nuts. You can go in and the practice will charge, or has a deal with United Healthcare for $875 for this procedure, and they'll have it with Blue Cross Blue Shield for $1,560. It's an absolutely incomprehensible system out there in terms of what insurers are paying to medical practices and the kind of coverage that you get.
It's almost like it's a broken system,
It is.
but it's the only system we have at this point to work with. And if you look at the second page of the handout, that kind of shows you the original Medicare with the drug costs on the left-hand column, and on the right-hand column, it shows the Medicare Advantage plans and the actual benefits of those.
I have a question.
Yes,
I am part of a retirement group on Facebook. I don't know if you guys, these are people who are just retired, been retired, and it's awesome because they're talking about the life experiences, nobody's selling anything, it's wonderful. But they're living it. I'm not yet, they're living it.
right.
And one of the things I've seen a few times down there is that they say, stay away from the Advantage plans.
Right.
That's, you know, there, in fact, one of the women on there was a nurse.
Mhm.
And she said, don't do the Advantage plans.
Okay.
Don't, that's her. you know.
Probably 99% of the people I sign up for Medicare Advantage plans.
Yeah.
And the reason some people think that that's smoke and mirrors is because if I'm on a Medicare Advantage plan and say that I come down with cancer and it's mid-year, now I got to contend with all these co-payments and co-insurances, okay? However, you can change plans mid-year if you have something called EPIC, and I'll get into EPIC in a little bit, okay? EPIC is a state-run program that helps elderly people with drug costs. So the Medicare Advantage plans are good plans if the people that are just turning 65 are healthy. They don't have a lot of medical expenses. They don't have a lot of drug costs. Like I said, 99% of the people I enroll are in Medicare Advantage plans. I get paid either way. If I sign you up on a Medicare Advantage plan or get paid or a supplement with a drug plan, I get paid either way. If I sign you up for an Aetna plan and I sign Mike up for United plan, I get paid almost to the dollar. So to me, it's what's best for the individual, the client. A lot of people say that Medicare Advantage plans aren't good because they don't understand how they work. So I had one woman down near Moravia. She had a Medicare Advantage plan. She ended up getting cancer in a year and had 2 surgeries. So I asked her, I said, add up all your medical bills and see what the amount was. And she came up with a number of roughly $5,000. So I assumed that she'd be switching during the EAP to a supplement. Then she's got a monthly payment and that's it. She goes, I think I'm going to have a good year. I'm going to stay with it. So it's really personal preference. I always talk to the individual. I try to do what's best for them. And I talk to a lot of people that work for school districts, municipalities. They're retired. They have the Empire plan through the state. And I always tell them, if you see an agent like me and he says they have a better plan, run the other way. Because when you have a group Medicare plan, that's better than the individual stuff that we offer. So if you're a school teacher, you might be spending a little bit more for Medicare Advantage plan, even though there are 0 premium plans out there, but through a school district, you might be paying a monthly premium for that. But if anybody here has elderly friends or family that have ever hit the donut hole or the coverage gap of their drugs, they'll be going along during the year paying a certain amount. And also September, October, their drugs prices go through the roof. Well, you just hit the donut hole. The federal government says, well, we're going to do away with that. So now it's a coverage gap. There's no donut hole. It's the same thing. You hit that, it's not a good thing. Okay. So it really depends on the individual. If you have a private group Medicare plan, like a school teacher would or a state worker, there's no coverage gap for donut hole. So yeah, you might be paying a little bit of premium, but once you get older, you're taking 10, 12, 15 drugs, you never have to worry about hitting that coverage gap. All right.
Kids, now what's the Medigap?
Medigap, that's the same thing as a supplement. Because that 20% gap, when you're on original Medicare, federal government's paying 80%, you're paying 20%. That Medigap is covering that 20% gap that you're responsible for. So Medigap and supplement, they're interchangeable. Okay.
Does
No.
that include Part D?
No, Part B, you'd have to get a standalone drug plan.
Okay.
So I'm going to wrap this up quick because I see Matt getting up on my peripheral. Last thing I want to touch on very briefly is different election periods. Okay. People that are already on Medicare, they probably see their mailbox get inundated with mail from all different carriers that time of year, September, October. So from October 15th to December 7th, that's what they call the annual election period. Everybody refers to it as open enrollment. Even agents refer to it as open enrollment. That's not open enrollment. That is your annual election period. You can make changes at that time. Any changes you make during that period have an effective date the first of the year. Okay, and it's the last application in. So if I talked to 10 different agents, and Mitch was my last agent that enrolled me, his actual application would be the one that I'm under. Okay, so that is during the fall time frame. Now, what open enrollment is from the first of the year to the end of March. If Mike signed me up for a plan and he didn't run my drugs, and I'm a diabetic, and I find out my drug cost is so high I can't even pay it, and I want to change from company A to company B, but it's still a Medicare Advantage plan, you can make like changes to like changes, and that would be available. Your effective date would be the first of the month after you enroll. So that would actually be open enrollment. So if you're not in those two time frames, like Michelle said, with the people not like Medicare Advantage plans, if I had something happen to me, whether it was a chronic disease or cancer, and I'm after that open enrollment period, I don't want to be paying copays and coinsurance just going for cancer treatment. So I want to change to a Medigap plan or a supplement. At that point, I could use my Epic. Like I said, Epic helps lower your drug costs for your prescription drugs. It's based on income. There's a sliding scale. The more money you make, the longer it takes you to qualify for it, but it doesn't cost you anything. If your threshold is $2,000, once you've paid Wegmans Pharmacy or CVS or whatever, $2,000 in copays and coinsurances, your Epic kicks in, and it costs your drug prices drop. But also what that does, it gives you a one-time change outside of open enrollment when you can make changes. Okay. And I only had to do it for one individual. It's because she signed up for a plan. She wanted to go back to Excellus, and she used her open enrollment to change from carrier A to carrier B. She wanted to change back. So, yes, Greg.
Is there anything for people that are younger, start putting away or something like for us? Like, is there any programs out there?
HSAs,
Um,
accounts.
I'll take my pick.
Yeah.
You're thinking,
Yep. Max that sucker out.
Yes.
There might be a few people in here that haven't reached the age of Social Security. Can you talk about just a couple sentences about people think what happens if you retire at 62 versus 65
Okay.
versus waiting past that to see how much more Social Security you can get if you can do it.
Quickly, I'm not an expert on Social Security, but I know a little bit about it. But the magic age now is 66 and a half.
Mhm.
You can retire at 62. It's going to be less of a benefit to you. And every year that you go past that 66 and a half, they give you roughly an 8% bump to your Social Security benefits. But you have to gamble. If I have a bad cough and one lung, am I going to wait till I'm 70 to start drawing? That's a conversation you should have with your physician and your financial planner. All right, everybody's
gonna pay that one fee anyways.
the 148.
Yeah.
Yep. There's no way around that unless you qualify as a low income. I'll wrap it up there. You guys all have my card. If you have any questions, you can either call me or shoot me an email. I don't want to go too far over and get banned.
You good?
I just want to share what is really important with me in my business about Medicare is that it only works in the continent, in the United States of America and its territories. So as we get older, we tend to want to travel. And if you're going to travel outside of the United States territories, you better have a supplemental insurance of a kind, whether it's travel insurance or whatever. The other thing is make sure you check with the country that you're going to, because they may not take your insurance. You may have insurance, and they may say to you, great, you have insurance, good. So pay us and go get your money from the insurance company. So, I mean, it's amazing. We get very bogged down and whoa, I'm covered. I got everything. No, you don't. So that's really important. I wanted to stay just in case I wasn't speaking, but
No, you're
I'm
absolutely
pretty
right.
sure.
People travel within the US, they're always worrying about with the PPO, if I'm in network or out of network. As far as Medicare goes, urgent care and ER visits, you're covered no matter where you go, continental US. Like Mac was saying, you travel different countries, you better get not only medical insurance, but like evac insurance as well. So that's a good point.
Thank you.
Yep.